Good afternoon, Dr. Bose. Dr. Bose, please educate me about swine flu. Is it something that we all should be scared of? What is swine flu?
Good afternoon, ma'am. It's a wonderful question you've asked. Yes, we should not be scared of, but there are a lot of things a common man should be aware of. Swine flu technically means the flu in swine, but actually it means that when an infected pig gives an infection to the human being, then what happens, the virus gets mutated. Mutation means, because as you all know, virus does not have independent existence. When you sneeze or cough, it goes into your human body. They need some vector to survive. So the people who initially, if I go back, way back in 2009 and 2008, when people who were handling this swine or the pig populations, especially the hog workers and all, so they got somehow infected because they were in proximity to this pig, because the virus needs some vector. Either they need bird or swine or something, because where they can survive, because they don't have any independent existence. So somehow this infection came to the human beings, and from the human beings then it got transmitted to other human beings. So now it has been found, the first time it was seen in spring of 2009. Ever since it gets attacks in different change of seasons, especially when there is a changing weather, the springtime and all. It comes in sporadics. So the WHO declared that from 2010 it has become pan-endemic, that it has spread across the globe. Of course, man-to-man transmissions through droplet infections, we call it, the sneezing, coughing and touching, it has spread. So basically swine flu is not the flu in swine, it is basically the swine flu which got transmitted to the human beings, and now it has become a pan-endemic flora. So in swine flu in nutshell means it's an H1N1 strain, because there is a specific characteristic of the vaccines and which is now there everywhere. But during change of seasons, especially these fluctuating seasons, when there is a changing weather is there, it comes back and gives rise to flu-like symptoms. So that is all about swine flu.
So what are the symptoms?
Look, as we know that this flu, if you read about the history, the flu has been there since 1928. This flu virus it's not something which is very new. It has been there since time immemorial. And if you read about the history in 1928, there was a huge Spanish flu. A lot of people died of this flu. But the more important thing that the flu is changing is colors, what you call the genetic colors very frequently. But the swine flu which we are getting since 2009, which WHO declared pandemic from 2010, which I mentioned, when we talk of swine flu, usually they are like similar like flu-like symptoms like body ache, fever, sore throat. But typically it has been found since swine flu, we get some specific symptoms in the sense that usually they have sore throat, high-grade fever, backaches are more important, and usually they have a lot of diarrhea and vomiting. So though in symptom-wise you really cannot differentiate, but whenever you find something unusual, like in the form of they have a lot of dehydration, diarrhea, very severe sore throat, and the fever is going very high, you should be suspicious. And usually it comes in clusters, because as I told you, you will find the pockets of people are getting it. Recently you've heard in Delhi people are getting it. So it comes in sporadics, what we call in endemics or pan-endemics. And so it is the clinical history is very important. Otherwise it's very difficult to differentiate. Whenever you have a suspicion that, especially in high-risk people, those who are asthmatic, those who are diabetics, those who are elderly people, when you have a lot of these symptoms like backache, high-grade fever and diarrhea, and you should always keep that possibility in mind.
So when to see a doctor?
Look, there is, as I said, there's nothing to get panicky, because as a pulmonologist, we see throughout the day so many hundreds of patients. We have never been scared, because already we have a good immunity. In India, since 2009, ever since it is not something a new virus. The same old virus since 2009, this is circulating in the environment. Most of the people have a good immunity against this virus. But if you have something like flu-like symptoms in the form of like common cold, nasal stuffiness, little fever and backache, you should not get worried about. You should see a doctor if things are getting worsened, if the symptoms are getting bad, and especially if you have some chronic disease or low immunity disease like diabetics, asthmatics, those who are on immune suppressants, on steroids, something unusual which you're finding, and you find that somehow the symptoms are persisting and patient is going down. then only you should discuss with your physician.
So how would I know I had swine flu if I had some symptoms?
Look, there is nothing called from the look or the symptoms you can diagnose a swine flu. Whenever you have a suspicion, whenever you find an high risk patient, as I mentioned you, extremes of age, sick people, diabetics, chronic asthmatics, on steroids, alcoholics, or whatever, whenever you have the high risk patients and you find somehow the patient is not looking good and you have a clinical gut feeling that this could be a swine flu, so you have to send the respiratory specimen. There's a specific test for that, which is H1N1 test, which is possible to get within 24 to 48 hours. So that is the only sure shots way of confirming swine flu. So you need a respiratory specimen, but you should send the specimen only, and as I told you, when you have a very high risk people. The high risk, the overall history is very important.
So do children and adults have same symptoms?
Usually the symptoms are similar, but children you may have much more something extreme because they tend to may go into a dehydration because they have a huge surface area. The vomiting may be more, but always remember there are certain important signs. If you note into adults or children, you should not delay, especially if you find there is a lot of respiratory discomfort, or if you find the bluish discoloration of the scales that shows that probably oxygenation is going down. If you find the respiratory rate is very high, patient is breathing very fast, there is an extreme prostration, means sickness or fatigue, and somehow the patient is getting drowsy or confused. So these are the ominous markers. That means the patient is going from bad to worse. You should not delay and you should take immediate prompt action.
So doctor, can I catch it from pigs?
No. As I told you, swine flu is just a name for it, because initially it was found in swine. You can never get it pig, because even if you well cooked meat, also meat doesn't give you. There's a lot of myths about this swine flu. Even the meat products doesn't give you. These are all well cooked. It is a strain which we are talking about, the 2009 H1, from where it started from the pig. That's why we call it a swine flu. So no way. It is there already in the virus. Virus is there always in the environment, and it comes in sporadic. It changes during the epidemics. Changing of season, it comes in bursts and affects the people who are high risk.
So how does it cross from a pig to a human?
Look, as I mentioned you, my initial, the question which you asked is that virus does not have independent existence. It needs some vector. That means some cells to proliferate. So initially it got into the pig. From pig, it came to the people who are handling the pigs, like the pig handlers or the hog workers. So they got the infection from the pig flu to the human flu. From human, it got transmitted from 2009 to the people around. So it is actually from pig to man, and now man to man it is getting transmitted. And it is always now, it is there in the environment. And whenever the season becomes vulnerable or favorable, this virus, they infect people. So initially it started in the swine, but later on, from the man it got transmitted to the environment. So now it is there in the environment. It's circulating since 2009. So that's why we call it swine flu, and it is not a new virus. Only thing the virus can change his genetic because of his mutations, we call it, but it is the same virus since 2009.
Can it kill me?
Look, usually most of the symptoms of these viruses are very simple, like flu-like, and they are not a very lethal virus, as I always tell. Because, as I told you, I'm a respiratory physician. We see so many people. We are seeing in intensive care, our clinical practice in hospitals. We are never being bothered because we feel that we have a certain amount of immunity about this virus. Only thing is when you have a high risk, as I told you, suppose your immunity is low, when you're very old, you're frail, you're suffering from cancerous disease, you're uncontrolled diabetic, you're alcoholics, your airways are not controlled, like you're an asthmatic, you're not on regular treatment, and your nutrition is very few. So it is something like host versus parasite. If your host is weak, then only the virus becomes. Otherwise, virus is a very simple virus. It is manageable, and usually it's a very self-limiting virus, and you don't need any specific treatment for it.
How long does the germs live on surfaces, like on my desk, if someone sneezes in my office?
Look, virus, as I told you, viruses are very weak, organisms. They cannot, even within few hours they die, because the moment they come into the surface of the table, or what we call the formites, or door handle, or lift doors and everything, the virus dies immediately. It doesn't have the property to stay for hours. Within few minutes it may die. So that's why we always say that whenever you're moving in these public places, or when you're in the places in the office areas, the lift areas, or using mask, if you carry a hand sanitizer, keep washing your hands. Usually the viruses are not transmitted, because viruses have very poor external life, and usually they get killed very fast on their own.
So other than hand washing and covering my mouth, if I sneeze or cough, what can I do to take care of myself and others?
Very important thing, that is what we always talk about it. Good care of yourself. The good care of yourself makes a lot of difference. As I always say, these viruses are there in the environment. It is the same virus which is there since 2009. A good care of yourself can make a lot of difference. There are 4 rules. First of all is that we always believe that if you really want to feel good about if you want to really take care of yourself, there are certain rules you have to follow. The first and foremost thing is the physical wellness. We call it the 360-degree wellness. The first and foremost thing is that you physically should be fit. You should go and get good exposure to the sun, because vitamin D takes care of your lot of respiratory infections. You do 40 minutes of brisk walking. Your diet should be very rich in fresh foods, citrus fruits, high proteins. You should drink plenty of water. You should sleep well. Your rest and relaxation program should be very good. You should always be positive, and you should take your asthma medication. It has been found that this swine flu virus usually go to the deeper pockets of the lung, and they can cause havoc, pneumonias, and what we call ARDS. ARDS is a disease. It's called acute respiratory distress syndrome, where your oxygenation goes down and you may die. And many of these patients go into ventilators. So all those high-risk patients, those whose airways are narrow, who are asthmatics or suffering from chronic airway disease or called COPDs, they should go to their doctors and adjust their programs. If they are regularly taking treatment, if they're eating well, if they're exercising well, if they are positive, if they are exposed to good sun, and following the good hand washing techniques, and of course regularly gargling and all those things, usually you are well protected.
Doctor, should I get flu vaccine?
Yes. Look, 2009, as I told you, that 2009, when this virus H1N1 virus got endemic, and finally in 2010 the WHO declared pandemic. So WHO is making these vaccines depending on the prevalence of the virus, whether it's a northern very hemisphere or southern hemisphere. So these viruses, vaccines are available, attenuated vaccines are available. So it is recommended that if you take the vaccines, so you are protected. And the vaccines are available in a lot of good companies which are making. You should contact your pediatrician or physicians to get a knowledge about it. But one thing is sure, that anybody who is more than 6 months should be vaccinated, especially in high risk areas where the pandemics are very high. But normally they say that above 10 years of age, you need only 1 vaccination. You don't need more than you don't need 2 vaccinations, but between 6 months to 10 years, we need 2 vaccinations. The vaccine should be given in 2 doses. They are very safe vaccines. We don't have much of a problem with these vaccines, and you should be given to all those people who are having low immune status, like diabetics, chronic respiratory disease, alcoholics, elderly people, young, children who are less than 10 years of age, and also health workers who are exposing themselves to different respiratory infection, like ICU workers, doctors, respiratory physician. They should be getting this vaccination, and these vaccinations are available. And it is better to take the vaccination much before the season sets in the pre-autumn time. If you get the vaccination, usually you are well protected.
Doctor, where can I get the flu vaccine in around SHAHBAZ?
Look, the vaccines are available in plenty. You can contact our foundations. You can go to our website like www.saansfoundationindia.com. You'll get all the information. But you can go to your doctors. There are good vaccine brands are available. All the major companies are making vaccines. But if you really want to know more about there is a CDC side, Center for Disease Control, Atlanta. They have the websites. You can all pick and choose the vaccines. And usually you should see the expiry date of the vaccines, and you should know where exactly. And as you mentioned about the South Delhi areas, these vaccines are available. But always I recommend, there's no point in taking the vaccines once the season gets over. The best time to get the vaccination is the pre-autumn time, is around September time. So if you get the vaccine in September time, you are protected for the next 1 year.
Thank you, doctor.
Thank you, ma'am. Thank you for sparing your time. Let me tell you one thing. You should not be scared about this flu disease. Flu is something which is there since 1928. Only thing, we have to be positive. We have to follow fitness programs. We have to regularly walk, talk, feel healthy about ourselves. We have to eat well. We have to take high proteins. We should not take oily foods. But if you follow these small, simple preventive precautions like frequent hand washing and gargling, I think swine flu is nothing. You can take care of this. This is only hitting the people who are not maintaining a good lifestyle, or those who are not taking care of their chronic diseases. Thank you so much.
Thank you so much.